The Meadows, recovery becomes reality. In the high Sonoran Desert, northwest of Phoenix, Arizona, with mountain views and clear skies, the Meadows provides a way to personal completeness and enrichment that serves the individual in recovery as a lifelong process. Confidential inpatient treatment is provided on a private 10-acre campus in an atmosphere of safety and peace.
With over 30 years' experience, the Meadows is a multi-disorder facility specializing in the treatment of trauma and addiction. Founder and former Senior Executive Director of the Meadows, Pat Melody, explains.
We developed a reputation pretty rapidly for being able to help people who hadn't been helped other places. We really take individualizing care seriously. We treat the patients with respect. We don't assume the patient's wrong. So if a patient comes into my office, I listen to them. I have an absolute open door policy. If you really want to have a quantum change in your life and be able to react differently in your relationships and learn about who you are and where you came from, there's probably no place does it like we do.
Here at the Meadows, care is expanded beyond single-level therapy to the diagnosis and treatment of multiple and underlying problems. The Meadows intensive treatment focuses on addictions such as alcohol, drugs, gambling, and work. Compulsive behaviors such as sexual disorders, codependency, relational issues, and eating disorders. Psychological conditions including post-traumatic stress disorder and obsessive-compulsive disorder, as well as affective disorders such as anxiety disorders, major depression, and bipolar disorder. The modality of treatment is group process, complemented by psychiatric and psychological assessments. The staff work with total dedication in the best interests of each patient. Pia Melody, clinical consultant for the Meadows, is known and respected as a preeminent authority, lecturer, and educator in the fields of addictions and relationships. As one of the pioneers in the field of recovery, she developed theories on the effects of childhood trauma that became the foundation for the Meadows.
Well, when I first got to the Meadows, which is about 1976, basically all we were doing was addiction treatment, mainly treating alcoholic executives. In 1977, we started getting a lot of people who were drug addicts. When Pat Melody came, he had a lot of really innovative ideas. And at that point, we made a major shift here and started to look at underlying issues that had to do with some things that we believe drive the addictions. As an institution, we have had years of being quite innovative. This staff is well trained, which I think makes us as a treatment center really stand out from the rest.
Upon arrival to the Meadows, a patient receives a full assessment, including a physical from a medical doctor, psychiatric evaluation, and psychological workup. The multidisciplinary treatment team, including the patient's primary therapist, will develop an ongoing, goal-oriented, individualized treatment plan. Peer support is an important part of the healing process. Peer mentors help new patients become acclimated to the Meadows campus.
An essential element to the inpatient treatment program is the week-long workshop, Survivors 1. This week-long workshop investigates the origins of adult dysfunctional behaviors by exploring early childhood issues that have fueled various addictions, depression, eating disorders, and painful relationships. In this revolutionary educational and experiential process, participants learn to identify and address family of origin issues. The primary focus of the workshop is to learn to deal with the emotions that accompany any less than nurturing past events, and then to work on the resolution of the consequential grief and anguish. Our childhood wounding or trauma disconnects us from ourselves, others, and the world at large. Healing or recovery is then about connection. Connection is the baseline definition of spirituality, connection to self, others, and the world at large. To this end, we focus on enhancing a spiritual awakening in treatment as it relates to connection. The invitation in treatment is to connect our own preciousness, along with the tools to protect and contain that preciousness in terms of learning and implementing boundaries in our lives. Family is an essential component to the recovery process. Within the inpatient stay, the Meadows offers an innovative 5-day family program that is pivotal to the effectiveness of treatment and the recovery process. Family members and significant others in the life of the client are invited by the patient to participate in what is for many a life-changing experience. Participants have the opportunity to learn about the many issues that have impacted the family as a system. The family is offered a variety of tools to more successfully address issues concerning mental health, addiction, recovery, and functional family systems. This is a wonderful opportunity to learn how best to be supportive of your loved one and to heal the pain as a family. In addition to the intensive inpatient program, the Meadows also provides 5-day workshops for participants who stay off campus but attend the 5-day sessions on family, couples, survivors, love addiction avoidance, grief, sexual recovery, partners of sex addicts, and selected other areas of treatment and reinforcement. In addition to inpatient and workshops, the Meadows offers extended care. Our extended care facilities utilize new modalities of treatment for trauma, including Dr. Peter Levine's somatic experiencing, as well as EMDR.
Melody House Extended Care for Trauma represents the fulfillment of a long-standing goal of the Meadows to create an on-campus extended care facility to provide ongoing care with a focus on trauma resolution. Melody House offers supplementary treatment and care for clients who desire to augment and safeguard their recovery. Clients at Melody House are drawn largely from those who received primary treatment at the Meadows, but Melody House also welcomes clients from other facilities that share the Meadows' focus on the origins and impact of childhood and adult trauma.
Dakota, Extended Care for Sexual Recovery, located on the Meadows campus, is dedicated to treating all aspects of sexual trauma. Dakota works with clients to sustain healthy sexuality by facilitating the healing of core issues, which enhances recovery and developmental maturity. Dakota also provides continued care with a focus on trauma resolution, 12-step traditions, and an emphasis on the holistic healing of mind, body, and spirit. The Meadows, Texas, Extended Care for Addiction and Trauma is located on 55 pristine and secluded acres in the Sam Houston National Forest, outside of Houston, Texas. This 8-bed facility offers ongoing treatment using the Meadows model, with a focus on addiction and trauma resolution. Like the Meadows, Texas is based in 12-step traditions and healing.
The Meadows recognizes our responsibility to make contributions to the professional and recovery community. The Meadows has world-renowned therapists on staff. These clinical experts present at training events around the country and educate staff on campus on groundbreaking clinical techniques. Additionally, the Meadows provides an extensive internship program, a professional journal, and continuing education. The Meadows provides alumni and the recovering community education in the form of lectures, workshops, and newsletters, as well as a yearly alumni retreat.
With over 30 years of experience, the Meadows is committed to confidential and caring treatment.
If you or someone in your family would like to free yourself from the pain of the past and move forward to a more enriching life, please call us. We are available 24 hours a day at 1-800-MEADOWS. Our staff will discuss your concerns and answer your questions. Call 1-800-MEADOWS.